Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering hygiene. If you haven't done so already, please be sure to like, comment, and subscribe below. Let's get to our first question. The first question. The nurse is caring for a client who has right-sided paralysis following a stroke. Which of the following factors would most likely result in decubitus ulcer formation for this client? 1. Poor nutrition. 2. Immobility. 3. Reduced hydration. 4. Skin secretions. And I'll give you a moment to think of your answer. And the correct answer is 2. Immobility. Guys, while all of these choices are great because all of these are causative factors towards decubitus ulcers, patient having poor nutrition, patient being emaciated, patient being obese, patient having reduced hydration, patient having lots of secretions such as sweating. All of those are factors that would contribute towards a patient getting a decubitus ulcer. However, the number one cause of decubitus ulcers or immobility. When that patient's immobile, they can't move, they can't get pressure off of that area. That's the number one cause of decubitus ulcers. Next question. The nurse delegates the hygiene care of a male client to the nursing assistant. In reviewing the client assignment, the nurse instructs the assistant to make sure to use an electric razor to shave the client with 1. Thrombocytopenia, 2. Congestive heart failure, 3. Osteoarthritis, or 4. Pneumonia. And the correct answer is 1. Thrombocytopenia. That patient that has thrombocytopenia. So thrombo means clots. Penia means a little bit of. If a patient has a little bit of clots, they're at risk for what? Bleeding. So that patient that's at risk for bleeding, we're going to use an electric razor on them to decrease the chance of them bleeding. So that patient that has thrombocytopenia, their platelets are down, they're not clotting, and they're going to be at the highest risk for bleeding. Next question. The nurse delegates morning care to a new certified nursing assistant. Which of the following actions by the assistant would be evaluated as appropriate? 1. Placing dentures in the tissue while not worn. 2. Cutting the client's nails with scissors. 3. Using soap to cleanse the eye orbits. Or 4. Washing the client's legs with long strokes from ankle to the knee. And I'll give you a moment to think of your answer. So the correct answer is 4. Washing the client's legs with long strokes from the ankle to the knee. What that does when she's stroking from the ankle to the knee, what's that pressure is pushing the blood that's in the veins to go back up towards the heart. Okay, so it keeps that blood from pooling. It keeps the legs from becoming swelled and edematous because of the fluid not moving, right? So it kind of acts like a TED hose. You know how when patients put on TED hose, that squeezing pressure is what pushes the blood back up to the heart? Same thing. Now let's look at the other choices because I want you to know why they're wrong. Number 1, placing dentures in a tissue while not worn. Well, we don't do that. The dentures need to go what? In a cup, in a container, and has to be labeled so we know who they belong to, not in a tissue. Somebody can just pick up that tissue and throw it in the garbage, right? Number 2, cutting the client's nails with scissors. Do we cut clients' nails with scissors? No. We use what? Nail clippers. And don't forget, when you're cutting clients' nails with nail clippers, you cut and you file straight across, especially with diabetics, right? Number 3, using soap to cleanse the eye orbits. No, you're going to get soap in the patient's eyes. You're going to cause irritation. So that's why number 4 is the correct answer. Next question. A 61-year-old client with diabetes mellitus has physician's orders for meticulous foot care. Which of the following is the best rationale for the order? 1. The aging process causes increased skin breakdown. 2. There's increased neuropathy with this pathology that places the client at risk. 3. The client probably has a history of poor hygienic care. Or 4. The lower extremities are difficult to see and therefore hard to maintain with good hygiene. And I'll give you a moment to think of your answer. And the correct answer is 2. There's increased neuropathy with this pathology that places the client at risk. Those patients who have diabetes have what's known as diabetic neuropathy, okay? So the feeling in the lower extremities are severely diminished. Why is that a problem? Why does that put the patient at risk? Well, if the nerve endings are severely diminished, that means if they have a cut, they won't know. They won't know the tent to that cut. They won't even know that that cut's there, right? So what happens, you know, that cut just festers, bacteria settles in, then before you know it, patient has a septic infection. Okay, what else is going on with that patient that has neuropathy? They have decreased blood flow to the lower extremities. Remember, blood, that is what carries oxygen, vitamins, nutrients to all of the tissues, all of the muscles, all of the cells. They need those vitamins, oxygen, and nutrients, okay? So with decreased blood supply, that patient is going to have decreased feeling, and with decreased feeling, they're at risk for injury. Next question. The nurse is instructing the client with peripheral vascular disease about daily foot care. The nurse's instruction for the client includes 1. Soak the feet 5 to 10 minutes each day. 2. Filing the nails into a curved shape. 3. Using commercial corn removers if needed. 4. Applying lamb's wool between the toes. And I'll give you a moment to think of your answer. And the correct answer is 4, applying lamb's wool between the toes. Why? The lamb's wool between the toes will cause dryness. It'll soak up the secretions. What you don't want, especially in a diabetic patient, is to have any wetness. You don't want any wetness between the digits, between the toes, okay? Because what happens is when you have wetness, it causes maceration. You have maceration, it causes skin to break open. The skin breaks open, bacteria settles in. Bacteria settles in, before you know it, that patient has gangrene and the foot has to get chopped off. Okay, so we always want their feet, especially between the toes, we want it to be dry. We don't want it wet. Okay, so number 1 is wrong. We're not going to soak the feet 5 to 10 minutes each day. No, you don't do that for diabetic patients. Remember, we don't want any maceration at all. 2, filing the nails into a curved shape. Well, a couple questions ago, I told you that you file and cut straight across, not curved. So we know that can't be the answer. Then you have 3, using commercial corn removers if needed. That diabetic patient, if they have corns, that needs to be removed by the podiatrist. You do not try to remove it, and you teach the patient not to try to remove it, okay? Because what happens is they may accidentally cut themselves. And you know what happens. They cut themselves, bacteria sets in. Before you know it, patient's got gangrene and that foot has to be chopped off. Next question. A client has recently experienced difficulty hearing out of both ears. Which of the following is the best nursing response to the client? 1, let's irrigate your ears with cool water. 2, can you turn your head towards me when I'm talking to you? 3, your hearing aid should not need a new battery for at least 3 months. Or 4, try to avoid putting Q-tip, cotton-tipped applicator in your ears. And I'll give you a moment to think of your answer. The correct answer is 4. You're going to teach patients to never, ever, ever use Q-tips. Matter of fact, you teach them not to put anything in their ear that's smaller than their elbow, which is nothing, right? What happens, and people don't realize this, when you use cotton swabs, yes, it may take a little bit of the cerumen out, but most of the cerumen, all it does is pushes it further. It pushes in further, and it causes impaction, and that's what causes the patient to be unable to hear. So you teach them to stop using Q-tips. Next question. An adolescent client with acne should be taught by the nurse to 1, apply moisturizing lotions or creams. 2, wash the face and hair daily with very warm water and soap. 3, use a depilatory to remove excess hair. 4, add moisture to the air with the use of a humidifier. And I'll give you a moment to think of your answer. And the correct answer is 2. You want to wash the face and hair daily with warm water and soap. And the reason that you're doing this, you want the patient to get rid of the oils that are on the face and even the oils that are in the scalp, because what happens is those oils that accumulate in the scalp, sometimes they seep down onto the skin, and those oils clog the pores and they tend to cause acne. So number 1, that can't be the answer. Applying moisturizers or creams? No, those moisturizers and creams, those are what clogs those pores and cause acne. So you're not going to teach them that. 3, use a depilatory to remove excess hair. I have no idea what a depilatory is. Anybody knows, go ahead and leave me a comment below. Thank you. And number 4, use moisture to the air with the use of humidifier. Well, guys, number 4, that choice would be great for somebody who has dry skin. But in this question, they're asking specifically about acne. So for acne, you want to keep that face clean and dry, as well as the scalp, to prevent buildup of oils. Next question. The nurse is preparing to assist the adult female client with perineal care. The position of choice for this client is 1, dorsal recumbent, 2, side lying, 3, supine, or 4, prone. And I'll give you a moment to think of your answer. And the correct answer is 1, dorsal recumbent. You want that patient in a supine position. You want their knees flexed and their legs open, because how are we supposed to get in that vaginal area unless they're on their back, knees flexed, legs open, okay? Now look at the other choices. 2, side lying. If that patient's on their side, how are you going to get to the perineum? 3, supine, they're on their back, but it says nothing about those legs being wide open for you to get to that area. And then number 4, prone. When patients prone, they're on their stomach. How are you going to get to the perineum area? So the correct answer is dorsal recumbent. Next question. A client who is suspected of having vascular insufficiency to the lower extremities is assessed by the nurse to have a 1, increased hair growth on the legs and feet, 2, dull appearance of the skin, 3, erythema upon elevation of the foot, or 4, diminished pedal pulses. And I'll give you a moment to think of your answer. And the correct answer is 4, guys, diminished pedal pulses. So if a patient's having a vascular insufficiency, their circulation is down, right? So when you check the pedal pulse, the pulse all the way down where their foot is, right? You expect it to be diminished. That pulse is not going to be strong because they have vascular insufficiency. Let's look at our other choices. Patients who have vascular insufficiency, you see number 1, it says increased hair growth. No. If a patient has vascular insufficiency, they're going to have decreased hair growth. Let me explain to you. Remember what I said to you earlier. Blood is what carries oxygen, vitamins, and nutrients. So if circulation is down, guess what? There's not going to be enough oxygen, vitamins, or nutrients to feed the hair so that the hair grows. So instead of the hair being plentiful and strong, the hair is going to be scarce. There's not going to be much hair on the lower extremities because there's not going to be enough oxygen, vitamins, nutrients to feed the hair growth. Okay. Number 2, dull appearance of the skin. No, actually, if the patient has decreased circulation in their lower extremity, you're going to see that skin is going to look shiny. It's going to have a shiny look, not dull. It's going to look shiny, or it might look pale, right? Because of the decreased blood flow. 3, erythema, elevation of the feet. Actually, what you would see if the patient has vascular insufficiency, you would see blanching on elevation. So that means as soon as that patient puts their legs up, their legs are going to blanch. You're going to see paleness automatically. Why? Because they already didn't have blood flow to begin with. And then what do? You put their legs up, which means less blood flow is going to the lower extremities. And that's why you're going to see the blanching. So when a patient has vascular insufficiency, the only one that's correct out of these choices are the decreased pedal pulses. Next question. Which of the following statements made by a nurse reflects the best understanding of the role of the bath in the nursing assessment process? 1, I work with my ancillary staff to be able to determine what is abnormal. 2, the skin's easy to observe for abnormalities when you're giving a bath. 3, I use the time to really look at my clients and determine what's normal and what's not. And 4, bath time's an excellent time to get to know your clients and form that nurse-client relationship. And I'll give you a moment to think of your answer. Okay, guys, the correct answer when it comes to the nursing process, it's going to be 3. I use the time to really look at my clients and determine what's normal and what's not normal. So you're doing A, assessment, right? You're looking, you're gathering information while you're giving the patient the bath. And then it takes a step further. You're doing D, the nursing diagnosis, when you're actually looking to see what's wrong with the patient, what's abnormal, and what your goals can be in the future for that patient. So the correct answer is 3. Next question. A client has developed several large mouth ulcers resulting from radiation treatment for oral cancer. The nurse recognizes that this condition will have its greatest immediate impact on the client's 1, comfort level, 2, nutritional status, 3, physical recovery, or 4, emotional well-being. And I'll give you a moment to think of your answer. And the correct answer, 2, nutritional status. If this patient has ulcers in the mouth, it's going to hurt for them to eat. Every time they eat, it hurts them. So the patient's probably not going to eat normally as they would. So their nutritional status is going to be affected. Now I want to show you guys something. 1, 2, 3, and 4. All of those are actually accurate in terms that they will affect the patient. They'll impact the patient. But what's most important is 2, nutritional status. If you guys have not watched my priority video, please make sure you watch it. I go over priorities, what's most important for a patient. And this is one of them. Patient's nutritional status, because it affects their physiologic integrity. Physiologic integrity is anything that keeps a patient alive, such as nutritional status, such as blood pressure, such as glucose, such as fluid electrolytes. The list goes on. If you're not too sure about that, make sure you watch my priority video. Next question. The nurse observes an adult client of Middle Eastern descent diagnosed with bipolar disorder attempting to bathe himself using only his left hand. The nurse assumes that the most likely reason for this behavior relates to 1, a cultural preference, 2, personal idiosyncrasy, 3, psychiatric diagnosis, 4, a need for personal control. And the correct answer is 1. They gave you a hint. They told you Middle East. So Middle Eastern, you should be thinking possibly Muslim or maybe Hindu. In those cultures, the left hand is considered dirty. So they clean themselves with the left hand. They do dirty things with the left hand. But the right hand is considered clean. So with the right hand, they'll do things such as eating or praying. Okay? Next question. The nurse is discussing hygiene issues with a group of mothers with young school-age children. When discussing the topic of head lice, pediculosis capitis, the nurse realizes that the most important motivation for preventing and or managing this condition is that 1, the lice may carry various other serious diseases. 2, the parasites are extremely difficult to remove and kill. 3, the presence of lice typically reflects poor hygiene practices. 4, the parasites are easily transferable from one person to another. And I'll give you a moment to think of your answer. And the correct answer is 4, guys. The most important motivation for getting rid of this is because they spread easily from one person to another. So some things you do have to teach the parents about this when they're treating the child. You teach them to make sure that they disinfect all the combs, all the brushes, all the hats. Make sure that they don't share any of these, such as a comb, brushes, hats, anything that goes on the child's head, not to share it with anyone else because it's very, very, very transferable. Next question. The nurse notes that the elderly client she is caring for has dry, flaky skin on her hands, face, arms, and legs. The nurse knows that elderly clients may need bathing. 1, more frequently due to keeping their warmer environments. 2, less frequently than younger clients due to dry skin. 3, with strong soap due to issues with incontinence. Or 4, with very hot water and vigorous rubbing to remove dead skin cells. And I'll give you a moment to think of your answer. The correct answer is 2, less frequently than younger clients due to dry skin. When patients are of the geriatric age, their skin is very, very dry. And believe it or not, showers dry their skin even more. So when they are of the geriatric age, it's not abnormal that the patient will only bathe 2, maybe 3 times a week. I want to go over the other choices so you can see why they're wrong. 1 is just plain wrong. More frequently due to keeping their warmer environments. That's actually false. They actually like it more cool. Okay, so that's false. 3, with strong soap due to issues with incontinence. That's false because you don't want the patients to have strong soap. The strong soap, it has a drying effect and they can be irritating to the patient's skin. So that's wrong. And then you have 4, with very hot water. Guys, that word very, those are one of the words I taught you about. Very hot? Absolutely not. The patient can what? Burn themselves. And then look at this, vigorous rubbing. So it didn't just say rubbing, it said vigorous rubbing. No, you might hurt the patient. You might open up their skin and that'll allow bacteria to come in, set in. So that's wrong as well. So the only correct answer is 2, less frequently than younger, because clients due to dry skin, their skin tends to be very dry. Remember, when they're elderly, a couple things are going on with the elderly. As they get older, their sense of thirst goes down. So they're not drinking as much, so they tend to be more dry, more dehydrated, and their skin is dry, right? And then on top of that, their sweat glands decrease. The activation of the sweat glands are decreased, so they don't sweat as much. So they tend to be dry as it is. So you don't want them bathing too often because it only causes more dryness. Next question. On assessment, the nurse discovers the dependent male client has athlete's foot bilaterally. Before delegating the bathing of the client to the nursing assistive personnel, the nurse needs to instruct the nursing assistive personnel to 1, use a lot of friction when washing the feet to remove the dead skin cells. 2, wash the client's feet last to avoid spreading the athlete's foot. 3, leave the feet slightly damp after washing them to prevent further drying and cracking of the skin. 4, apply the sulfonamide to the lesions on the client's feet when she is done bathing the client. And I'll give you a moment to think of your answer. The correct answer is 2, wash the client's feet last to avoid spreading the athlete's foot. So guys, athlete's foot is a type of fungal infection. And fungal infections, they are very contagious, okay? They can transfer from one place to another. So if a patient, for example, has tinea capitis, that's the fungal infection in the head, in the scalp. They touch the tinea capitis and then they touch their skin here. Before you know it, they'll have tinea corporis. That's the fungal infection of the skin. Okay, so it's transferable. So that's why you're going to teach the CNA to wash that last so you can avoid transferring that fungal infection to other parts of the skin. Okay, by the way, athlete's foot, how does patient get it the most? Well, fungal infections love to develop, they love to thrive and live in moist, dark environments. So think about the athletes that they're always running or they're doing something to make their feet do what? Sweat, right? So you have that sweat and right over that sweat is socks and shoes. So a warm, wet environment is the perfect environment for fungal infections. So that's why number 2 is the correct answer and none of the other choices. Next question. On examining a client's fingertips, the nurse notes that they are excessively dry. The nurse knows that this can be caused by which of the following? 1, fungal nail infections. 2, dry climates. 3, washing dishes by hand. Or 4, polishing nails and using polish remover. And I'll give you a moment to think of your answer. The correct answer is 4, polishing nails and using polish remover. Some nail polishes, but definitely polish removers, they are very strong and irritating to the skin. Okay, so that's why you'd expect to see their nails to be very, in the question, it says excessively. That means very, 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 very dry. Okay, many nail polishes are have irritating chemicals in it, but definitely polish remover, it's very irritating and tends to dry the surrounding skin. And we have one last question. Which of the following statements by the client demonstrates that they need further teaching regarding oral hygiene? 1, I need to brush my teeth after meals. 2, I need to floss my teeth daily. 3, I should replace my toothbrush annually. Or 4, I should get a checkup every 6 months. And I'll give you a moment to think of your answer. And the correct answer is 3, because remember, this question is asking you which one is wrong, okay? I should replace my toothbrush annually? No. The patient needs to be replacing their toothbrush every 3 months. And if they happen to have an infection in their mouth or throat, such as strep throat, right, they need to change it more often, because the patient gets a medication for strep. You know, they getting gram-positive antibiotic, they're getting that for 10 days. And then what happens if they're still using the same toothbrush? They're going to reinfect themselves. So the regular average person, every 3 months, if they have some kind of infection in their mouth or their throat that they're getting treated for, they need to change it even more frequently. And that is it for hygiene, guys. I hope this video was helpful to you. Please, if there are any videos that you want to see in the future, any questions that you have, anything that you want to clarify, please leave a comment below and I'll be sure to address it. If you haven't done so already, please be sure to like, comment, and subscribe. Thank you so much for joining me, and I'll see you next time.